we've been working on healthcare reform for more than a year. We are acting. Now is the time to act. We've had umpteen hearings and roundtables. We have a product here that accomplishes our objectives, healthcare reform. It's fiscally responsible. They can all be very proud of what we've achieved here. To lower taxes for more than 42 million Americans, protect Medicare benefits for seniors, expand healthcare coverage. It builds on an employer-based system. What majority of Americans know, most can keep what they have. It helps our most vulnerable. Tonight, I think we're very proud of what we're doing. And I want to thank my colleagues for their help, because together we have worked very well together. We've been very proud tonight of what we've done. And I especially thank my colleagues for all your efforts. And as we've discussed, next week we'll vote on the final product after we get the score back from CBO. And together we can achieve the key goals of healthcare reform that lowers costs, expands coverage, and is very significant health insurance market reform. And the one point I want to make here too, which I think is particularly critical, and that's delivery system reform. We are starting here in this bill to finally reform our system, our delivery system, so it's based on much more on quality and patient focus. It's coordinated care on patients, moving away ever so slowly, but inexorably from fee-for-service, which tends to cause a lot of the waste that occurs in our system. And we're not going to see the savings here. We're not going to see the benefits of this for maybe a short while. It's going to be a few years. But after 4 or 5 or 6 years from now, we're going to see real benefits here because of delivery system reform. And I see my colleague from Washington nodding her head, because she has been a real pioneer in pushing quality in delivery system reform. And I'm just very, very proud of you, Senator, for your efforts there. And the same we said for every member here. We sense what needs to be done. We've made some major decisions here. This is also a strategic bill. It's not just piecemeal. We do something this year and something next year. It's a strategic plan to address our healthcare delivery system. It's not only delivery system, but it's the other components I've mentioned. I'm just very proud of our mutual effort to accomplish what we've done here.
Thank you to our staff.
Mr. President.
Thank you to you, Mr. Chairman.
Could I?
Senator Grassley, then I was.
Are you done? Are you done?
Well, no, I'm not.
Okay, go ahead.
I'm looking at people here who are about ready to drop off their chairs.
Yeah.
Who have worked so hard, and behind us, all around. I mean, we worked. Let's give them one. One reason I want to finish tonight so they can begin the weekend and get some rest,
Yeah.
and which they more than deserve.
Like he said to my staff after the Medicare Modernization Act, I was supposed to give my staff a long time off, so you folks can take a long time off. What I wanted to say, Mr. Chairman, is you know, there's a product here that most of the people on my side, maybe all the people on my side, may not vote for next week when we work on it, but I do want to applaud you for the fair process you had. There's just a few moments of tension, but for the most part, this was conducted in a very gentlemanly and lady-like way, and I want to thank you for that.
Thank you very much. Thank you. Thank you. Okay, and so the committee will stand in recess until 10 o'clock Tuesday.